the data is in. Let's talk about the increase in cardiovascular disease-related mortalities here in the U.S. over the past 3 years since the start of the COVID-19 pandemic, drawing upon a recently published paper that is using statistics from our own database here, the National Vital Statistics Systems. It was published in the American Journal of Preventive Medicine, titled Trends in Cardiovascular Disease Mortality Rates and Excess Deaths Between 2010 and 2022. The authors say 10 million cardiovascular disease-related events occurred here in the U.S. 75% of these was from heart disease, 16.9% of these were from strokes. What's interesting, though, is between the years 2010 and 2019, the cardiovascular disease age-adjusted mortality rate, which is known as the AAMR, declined 8.9%. Again, this is leading up to the pandemic. There was actually a decline in cardiovascular disease mortality. And then this increased 9.3% between the years 2019 and 2022, which is 454 deaths per 100,000 people, which is approximately the 2010 death rate, which was 456 per 100,000 people. From 2020 to 2022, 228,000 excess cardiovascular disease-related deaths occurred, which was 9% more cardiovascular disease-related deaths than expected based upon trends from 2010 to 2019. Results varied by cardiovascular disease subtype and subgroup population. Okay, now we're going to continue on with these statistics and share with you the stroke increase, which I think is particularly interesting. But first, friends, I just want to say thank you for being here. This content can be censored, so I really, really appreciate you sharing this as a direct text message with a friend. We're not going to talk about anything controversial in this video. We're just sharing facts and numbers that you should know about, because cardiovascular disease is the most likely cause of mortality for all of us living. So we should do a lot of things to help prevent cardiovascular disease. Exercise is one of them. If you are into exercise, which you should be, you definitely want to check out the Myoscience novel creatine-containing electrolyte sticks. You can use these during or after your exercise sessions to increase your exercise economy. You can check that out in the description below, and please use the code podcast at checkout. It's one of the only creatine-containing electrolytes out there with high-quality minerals, as well as 2.6 grams of creatine. Okay, so let's continue on and talk about the stroke increase and which age range was most affected by this increase in cardiovascular disease-related mortality, which I think is quite interesting. I think it's a phenomenon we should actually be discussing more about. The subgroup with the greatest percentage increase in excess deaths relative to expected deaths included adults between the ages of 35 and 54 years of age, as well as adults between the ages of 75 and 84 years, as well as African-American adults and Asian and Pacific Islanders. Okay, so just to reiterate here, the group that experienced the largest percent increase in excess deaths above expected deaths was adults between the ages of 35 and 54 years old. Now, lest I remind you, this is the most unlikely group that would experience an increase in excess deaths from cardiovascular disease-related mortality, because we know that heart disease is a phenomenon of aging. We would expect that adults over the age of 75 or 65 would experience the largest percent increase in excess deaths. But I think this is quite fascinating and something that we should consider. What was driving this more than expected excess deaths? I mean, I'll be 42 this year. I mean, imagine hearing about a 42-year-old getting a stroke or a 35-year-old getting a stroke or having a heart attack. This is something you don't really hear much about. You do hear people getting heart issues and strokes and having issues like that in their 60s and 70s and 80s. But generally, this is an anomaly. But throughout the COVID pandemic, because of lockdowns and what are argued gym closures, excess alcohol consumption, fast food, encouraging people to stay home and not exercising, all of these factors create this perfect storm to exacerbate the underlying predisposition to develop cardiovascular disease and its associated complications. Here's the stats on strokes. I think this is really interesting. Excess deaths attributable to stroke accounted for approximately 19.8% of excess deaths from cardiovascular disease overall. The subgroups with the greatest percentage increase in excess deaths included all adults aged between the years, you guessed it, 35 and 54 years of age. And so that was about 15% above baseline. Okay, so just to reiterate here, we saw a 13% increase in mortality from heart-related issues, heart attacks and things like that, in adults between the ages of 35 and 54 years old. Now we saw a 15.8% increase in strokes in individuals in that same age group. How often do you hear about, as I mentioned earlier, a 35-year-old having a stroke or dying from a stroke? Pre-COVID, You rarely heard about this. And there's multiple factors that could be going into this. I would argue that exercise insufficiency, overconsumption of hyperpalatable foods, encouraging people, as happened here in King County, where I live in the state of Washington, hey, hop on Uber Eats and just have Chick-fil-A deliver you food. Don't go out. Heaven forbid you go outside and leave your home, order these fast foods, and please don't go to the gym. I mean, you can buy liquor, you can buy cigarettes and porn and whatever else, but you couldn't go to a fitness center, which was absurd. Okay, so let's just summarize here. From 2010 to 2019, the stroke age-adjusted mortality rate declined 5.6%, from 76 per 100,000 to 71 per 100,000. Now, from 2019 to 2022, the stroke age-adjusted mortality rate increased by 13%, meaning 75 people would die per 100,000 population. So this is how you look at these in epidemiology. Now, this represents an annual average percent change of 4%. The national stroke age-adjusted mortality rate has not been at that level observed in 2022 since before 2010. So obviously something happened here. Now, it's important to acknowledge that just getting COVID, especially the Gen 1 version of COVID and even other variants, the Delta variant and things like that, do increase blood viscosity and cause heart-related challenges. So I'm not discounting the fact that getting the virus in and of itself didn't possibly contribute to this, but you have a virus that exacerbates underlying cardiovascular issues in a population who was pretty unhealthy for at least a year. Most places, at least on the West Coast, were in lockdowns and had stay-home orders, and people gained a lot of weight and things like that. So it's important to acknowledge, in hindsight, and this was something I was heavily criticized for at the time, we have to look at the bigger picture here, and we can't be robbing Peter to pay Paul, causing people to stay in their homes and get unhealthy from a cardiometabolic standpoint in hopes that they will prevent even coming in contact with this virus. And we know that to not be the case. If you look at antibody studies, most people have come in contact with SARS-CoV-2. So the cat was out of the bag. The horse was out of the barn. It was impossible to completely contain this virus because it was seeded all throughout the country. So the idea that promoting lockdowns and school closures and business closures and preventing people from accessing fitness centers would somehow save lives was just not really rooted in well thought out policy, which was my criticism the entire time. And so we should have been simultaneously encouraging healthy living and also for the vulnerable people, minimizing their exposure to the pathogen. But that really wasn't talked about. And now we have a lot of people who, statistically speaking, the folks between the ages of 35 and 54 were very unlikely to actually die, even from the Delta variant or even the OG variant. So we had a massive increase in excess deaths, unnecessarily, probably because of poorly thought out containment strategies. And so I think that is really unfortunate. And if you look at the total number of excess deaths attributed just to strokes, it was 45,000 people between the years 2019 and 2022. And this represents a 10% bump above baseline in terms of just strokes. And so here's the figures. So you can see these. So you can see the downward trend, in the early, 2010, 2012, it seems that people were getting more active. There was more and more access to fitness centers and gyms. And the lowest age-adjusted mortality rate in terms of both cardiovascular disease, heart disease, and strokes occurred in the year 2019, pre-COVID. And you can see these from figure 1, the age-adjusted rates of cardiovascular disease, heart disease, and strokes, deaths per 100,000 population. And you can start to see these dramatically increase up to 2022. Now, that doesn't really make a lot of sense in 2022. Lest I remind you, the Omicron variant started to come on the scene late 2021, early 2022, and this was significantly less virulent or pathogenic compared to previous variants. And so it doesn't make a whole lot of sense that we're still seeing in 2022 excess deaths from strokes and cardiovascular disease. So I think there's more questions than answers from this particular data set. But I do think it is important to remind all of our friends and family the most probable reason that they will, as well as you, will succumb prematurely and die prematurely is from heart disease or a stroke. And so this is why we have many interviews like with Dr. Phil Ovadia talking about how to prevent heart disease, how to improve metabolic health. It's not necessarily the butter or the cholesterol from eggs or red meat that is worsening heart disease. It's the hyperpalatable processed foods, the junk foods, the seed oils, the fructose, the sugar, all of that. And so we all need to be very vigilant about the foods that we eat and the lives that we live if we want to live optimally healthy lives and prevent these diseases that are clearly killing a lot of people. 10 million people over the past 12 years died prematurely from stroke and cardiovascular disease. And as these statistics show, the group that saw the largest increase in deaths was relatively healthy young people in their 30s, 40s, and early 50s. And so we want to prevent that in the years going forward. Last but not least, here's table 2. This really helps convey the story. And you can see the percent increase over here on the right hand of the column. And again, the subgroup that experienced the largest excess death increase was, as we've been talking about, the people in their mid-30s, their 40s, and their early 50s, which is actually quite surprising. And actually, if you look at females, again, this doesn't make a whole lot of sense because we heard throughout COVID that the virus itself disproportionately affects men. But you look here in the females in terms of the percent increase above baseline, there was a 9.8% increase in female excess deaths versus just 8.3% in males. And so I think that is quite interesting, friends. What do you think? I would love to know what your thoughts are. Leave me a comment in the comment section below. Thank you, as always, for hitting that like button. Thank you for sharing this video, and we'll catch you on a future episode down the road.